Tonight, we're fortunate to have Professor Patihis with us on the podcast. He's a senior lecturer at the Department of Psychology at the University of Portsmouth in the UK. Welcome.
Thank you. It's good to be here.
And thank you so much for coming to discuss this very important topic with us. It seems to be trending. We've been getting a lot of inquiries about it, and you've certainly written a lot about it. So we'd love to hear some of your thoughts about first of all, about repressed memories, false memories, how are they implanted, and why this fad of repressed memories or recovered memories that was so popular in the 80s and 90s is now back again. So maybe if you could give us a little overview on your thoughts on that.
Yeah, well, if I focus on repressed memories to start with, false memories is a slightly different topic, which explains a lot that happens in repressed memories. But repressed memories is the idea that came from Freud that you can go through a trauma, you then suppress that trauma because it's so painful. And then there's a period of time where you did not even know that the trauma happened, and then you can recall it later. The trouble is, we don't actually think that this is how the mind works. Freud came up with this idea from just seeing patients. He never measured anything, never did any science, apart from a little bit of neurology that he did before he did this. And science has really not substantiated the idea of repressed memories. As you mentioned, the 1980s were, there was a surge in false memory cases through therapists believing in repressed memories and trying to encourage patients to recover repressed memories. So you saw many, many cases of false memories in the 1980s. In the 1990s, the scientists caught on to the problem. They realized that a lot of these memories in the 1980s were false. There was quite a few cases that were obviously false, some legal cases as well. And that's when the memory wars began in the 1990s. The 1990s is when cognitive psychologists who were not focused on clinical psychology for the last 2 decades suddenly realized what was happening in these dreadful therapies. And then they started to speak out and say, we don't actually think that repressed memories are real. And there's been this battle ever since. And just to bring you up to date on this, there's still quite a lot of clinicians that will not let go of this idea of repressed memories. And they just do not call it repressed memories anymore. They call it dissociative amnesia. And to give you an idea of how big the problem is, this category of dissociative amnesia, which is very similar to repressed memories, is in the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders. So it is probably not going to go away if it's embedded into the DSM. So that's how it is right now.
Sorry to interrupt. So dissociative amnesia, did that get recognized into the DSM-5 along with these studies, or was this something that was categorized for some other issue? Because I'm very familiar with that DSM-5. I haven't run across that myself, but when did that get into the manual?
It got into the manual through clinical folklore, basically, going all the way back to Freud. The ideas never really died out. There's no measurement studies that established it. In my view, it's never been established. But to give you an idea, it's been in the DSM for a long time. So in 1980, for example, it was called psychogenic amnesia. Same concept. In 1994, the name was changed to dissociative amnesia, and it's stuck in the DSM ever since. That there is about maybe 20 of researchers like me who making arguments in various articles that we think it should be taken out of the DSM. The reason that we think dissociative amnesia should be taken out of the DSM is because every time a clinician diagnoses it, they do not actually know that it's caused by trauma. So they are sometimes observing real amnesia, but they are just guessing that it's caused by a traumatic event. It's really too difficult to rule out it being caused by something going on neurologically. So there's quite a lot of us who think that amnesia is always neurological, or it's always organic. Amnesia is. So
that's very interesting. Okay,
and dangerous.
Well, absolutely. So you've spent and you've written extensively with respect to recovered memory, the debate about it, and I would like to just zero in a little bit on, if you can, about some of the studies that you've been involved with and some of the papers you've written, so that we can tease out, if we can, what would lead you and other experts in the area to say that really these types of recovered memories are not reliable and really not something which is a genuine manifestation of something that did happen in the past?
Well, the first thing to mention is in the entire literature, there is not good evidence of repression. So let's just say that first. So in other words, all the converging evidence from neurological studies and from cognitive studies all converge, not point to the idea that repression is possible.
Okay, so let's just pause there for one sec. So the amount of evidence that exists, essentially in and of itself, about repressed memories or recovered memory is essentially unreliable science.
Yes. If you think about repression, it's an invisible concept, so it's not really in the realm of measurable science. That's one of the problems of it, However, in the area of measurable science, where you do actually measure things that you can measure,
that's what I want.
The way to say is none of the evidence points towards the idea of repression. It all points towards the idea that trauma is usually remembered all too well. So I'm thinking about neurotransmitter studies that I'm thinking about stress studies with animals. All of them point towards stress and trauma being remembered all too well. So the more shocking, the more you remember it. So that's on the one side. There's not good There's not good evidence for repression. On the other side, there is a lot of measurable studies, studies that measure real things that you can really measure, such as false memory studies, that explain this phenomenon much better than the repression hypothesis. So in other words, this is what I think you might be getting at with the question. In other words, we have discovered that there's some factors that lead to false memories. So we have discovered that if you give false suggestions to somebody, a lot of individuals create a false memory shortly afterwards. In false memory studies, we know that we can implant whole false memories for things like being lost in the mall, things like spilling punch at a wedding. These are all autobiographical memories, and that again, that is done usually by suggestion that something happened that it didn't, and then you give a delay in time, and then you test their memory later.
Okay, so this is really interesting. So on one hand, as you've described, there are some ways to measure or to take some science to determine what happens when somebody experiences a traumatic event. And you said something which is very interesting. When someone experiences a traumatic event, they remember it all too well. In other words, it's something that generally stays with the individual as time goes on. And of course, sometimes we may have time impacts memory, but it's not something that they just forget or repress and then recover. It stays with them throughout time.
And there is some evidence for that, so there's different traumas that we know really happened in the world that you can ask people about later. So this was done with Holocaust survivors. And in that study, they found that everybody who went through the Holocaust remembered that it happened. They remembered details a little bit more vividly of their trauma compared to their day-to-day lives. So, in other words, 0 people remembered this real trauma. Same with Rwanda. The Rwanda genocide in 1994, I think it was. An article just came out about 6 weeks ago that showed that none of those people who experienced that trauma forgot the trauma, repressed the trauma, or anything like that. And just a final study, when you measure known awkward events in medical procedures, so I think it was a genital procedure done on children, when so it's kind of similar kind of embarrassment to maybe abuse would be. When that's documented, then you ask the children a year later, all of them remember it. So when you do these careful studies where it actually happened, and then you ask people about something fairly traumatic, you get 100% of people remembering that it happened. They do have some problems with the details sometimes. They're not perfect, but just that central tag in your mind that it happened seems to never be lost in real trauma.
That's very interesting. So then the second thing which you said, which was interesting, is when you can, when we conduct other studies on individuals, you can see that in fact the mind and memory is quite malleable, that within the right setting, particularly could be therapeutic settings, it is very real that you can implant memories or create false memories just through the process of manipulating the individual, maybe intentionally or not.
Yeah, there's been some studies that show that you can implant false memories when somebody is really relaxed. Like, for example, in hypnosis, if you get somebody to relax, that seems to be when they become quite suggestible. So false memories have been created in that scenario. The other area of research that has created false memories is this area called imagination inflation research. And it's basically similar to a therapeutic technique called guided imagery. So when you take people through imagining a scene as vividly as they can in a therapy session, for example, and you get them to expand on it week after week after week, then they come to misremember that as actually happening over time. And so one of the things to say about that area is when you scan people's brains and look at the networks that are activated during imagination, it activates all the same areas in a very similar way to when you remember something. So the brain is the brain is not great at distinguishing between imagination and real memories. They feel the same, they activate the same areas of our mind. So in other words, you can imagine things vividly over in therapy, and then you lose a little tag in your mind that tells you that it was your imagination. The source of the information is misplaced as being a real memory later on. And just to kind of relate to something I said earlier about the relaxed state seems to be a dangerous state for suggestion. This also happens in sleep paralysis. So during sleep, there's this phenomena called sleep paralysis, where we wake up halfway and we kind of hallucinate dreams, but we don't, and we think that the dreams are actually happening in the room. That's another source of false memories, where somebody might, imagine in their hallucination being abused or something like that, and then they may think that it actually happened. So anyway, so that answers some of your question.
I had a question. You've mentioned trauma tags. I use that expression. In the research you've done in terms of implanting memories, can trauma tags be implanted as well? Because I think there's a difference between a traumatic event versus the punch bowl experiment or the lost in the mall experiment. Those are somewhat a bit more innocuous, and I know there's ethical boundaries, obviously, to implanting traumatic memories. But do you feel the effect could be the same?
Yeah, I think there's similar memory processes in these events that we are allowed to implant, such as being lost in the mall, and those traumas that we're not allowed to implant in the mind. So what you have to do with real traumas is look at the evidence outside of the experiments. You can't really do experiments with them. So in other words, there are maybe 10, 20 famous cases of false memories that occurred in legal cases where we're pretty sure that the memories were false, right? So and sometimes there's DNA evidence that tells you that, oh, we know it's false. So, right. So one example of that is the George Franklin case, where his daughter accused him in 1989, I think it was, that she then accused him of a murder. She accused him of a murder in 1969 of her childhood friend, and then later on in the mid 1990s, she accused him of 2 other murders. Now, there was DNA evidence for 2 of those murders, and it turned out that DNA evidence matched another person. So this individual was creating false memories. Eileen Franklin was creating false memories using hypnosis. So you sometimes have to go to the real life to get evidence of the trauma being implanted. And, so in her case, Eileen Franklin, she was going through hypnosis. She was imagining what might have happened in 1969, building up the memory of seeing her father murder a child. And then she loses that source monitoring ability, the ability to monitor where the source of the information is coming from. And she incorrectly places the source as a real memory instead of her imagination during hypnosis, which is the correct source. So yeah, it does happen in real trauma cases, but it's difficult to study. And just let me tell you about something else that is kind of an experiment that we're not allowed to do in the lab, but it has happened in a legal case. Richard Offshee in the 1990s had a case that he was serving on, and the individual had confessed after his daughter confronted him with allegations of severe sexual abuse, if I remember correctly. Richard Offshee suspected that this individual had been confessing to false memories because he was so suggestible that when his daughter came to him and suggested that it happened, he had a technique of preying on it and doing a kind of similar technique to what his daughter did to try and recover memories. So Richard Offshee did kind of like a false memory experiment where the psychologist Richard Offshee made up a new trauma and suggested that his client think on it and tell me if this actually happened, something completely false. And sure enough, 2 days later, his client came back and said, "Yeah, I can remember it now. I did abuse my daughter in this way as well." And then Richard Offshee obviously then concluded that his client is very suggestible, and his preying technique that he's using to imagine what may have happened was creating false memories. So there is quite a few cases that point to the idea that it has been done in real life as well, creating false memories.
Can I move you now for a moment to about your work, let's say within the investigative context? So let's say somebody is in a therapeutic setting and they start to talk a little bit about maybe some memory, and then the therapist starts to talk to them about it, and then it goes to police for investigation. How dangerous can investigative techniques be in enhancing what may be a false memory?
Well, they're very dangerous. Sometimes the techniques of the therapist sometimes are the problem. Sometimes the client themselves creates a problem themselves. In other words, they come to believe that repressed memories are in them, and then they take the lead in it. But a typical way that it can happen is the client, the psychotherapy client at the beginning has some kind of problem that they want to solve. So they're searching for meaning and searching for a solution that may make them feel better, might give them a cure. So there's always a good motive usually. The therapist sometimes helps reappraise the parent. Is usually a parent in the first parts of the therapy, in the suggestive therapies, and that reappraisal of the parent can shift the whole view of the client's childhood towards the negative. So they can focus on the negative, and that's kind of like a seed that tends to happen at the beginning. So the reason that you're having relationship problems is probably your childhood. So it's very vague at that point, but it sets a seed of reappraising parents in the negative direction. And then what happens at the beginning of some therapies is the therapist then educates the client over the first few weeks of how memory and trauma works, and they get it completely wrong in these bad therapies. So they educate the client saying that sometimes people with this physical disorder that you have is caused by trauma. I've seen this many times before in my practice, they might say, and if you can remember some of this trauma and work through it, or unrepress it or work through it, then you may be cured, or you may make progress and solve this problem.
Well, it's like that famous book from the 90s. You remember Courage to Heal? One of the one of the opening lines in the preface was, if it feels like it happened, it probably did. That's kind of what you're getting at.
So that's one of the kind of educational things that people are told at the beginning of these problematic therapies. And then that sets the scene for the false memories that then come afterwards. And it happens quite gradually sometimes, where they work together to imagine what might have happened. And even without much suggestion from the therapist, you can develop false memories. Because if you set up the motive to remember traumatic memories, the therapist doesn't have to do much suggestion after that. They just have to do imagination exercises each week, or talk about what you can remember now. This week, what else can you remember? Can you picture in your mind what the basement looked like? And then they expand that memory, and over time, the memories become very strange and very false memories are developed in this way.
And so, you raise this issue, and it's interesting because it really has two aspects. One, you can be creating, as you say, you reapprise, you reassess what the relationship with the parent was, and then out from this therapy comes some sort of a false memory of a past trauma, let's say a sexual abuse. But the other thing that can happen is when somebody is searching for certain cures. In other words, there's things going on in their life that hasn't gone well. They may have had not the best childhood, maybe a number of issues like drug addiction and other things, and they're in with a therapist. And depending upon how the therapist discusses and relates their history with either a friend or a past partner or a past parent, you can maybe not necessarily create a false memory, but then you start to recast or relabel what that relationship was like, and then now view it completely differently in order to try and, I don't want to say justify, but find a reason for what their current problems are. So there's really, there's a very insidious one, which where you actually create a false memory, but another one where you go back and relabel or recategorize what a relationship was in the past. Those are two real possibilities with these type of therapeutic techniques.
Yeah. And I think the reappraisal sometimes happens towards the beginning of the process, and kind of memories of emotion are changed at that point. And then I think once that's set up, you get false memories coming a bit later in the therapy process.
Let me just ask you for a moment. Let's say something then goes on to the police, and they're investigating. What would be your advice then because it's very hard in investigations where police are taking statements. Some of them may be much more relaxed about it, but depending upon how questioning goes in an interview, it can only serve to reinforce what would otherwise be a false memory or an inaccurate memory.
Yeah, well, the police have to be very careful not to say anything suggestive themselves. And in some of the cases I've worked on, they can be suggestive, so they'll say things like, people never, and so whenever people report this, it's always true. They'll say something similar to that to both the claimant and to the accused as well sometimes. So the way to do it properly is to maybe use something like a cognitive interview. So this is a type of interview that's been developed by psychologists that is much less suggestive. So in a cognitive interview, you build rapport. You never give any suggestions throughout the whole thing. You build rapport at first, and then you ask very open-ended questions about, okay, tell me about what you can remember, and just let them fill the scene themselves. And then you can ask, oh, could you tell me a little bit more about that? Again, there's no suggestion, to get them to focus on specifics. And it tends to be the case that the first interviews tend to be more accurate than the later interviews. So if there's repetitive interviewing, interviewing that's motivated to kind of build a prosecution, it's the earlier interviews that tend to be more reliable than the later ones. They can be unreliable, of course, if they've just been through 2 years of therapy. Okay, so the first ones can be unreliable, but they tend to get worse. Distortions tend to get worse over repeated police interviews. So, in other words, it can really help the defense to see if they can find out if there's been any prior interviews before they have the recorded interview, and then that those prior interviews might explain how the story became so tight and ready for a prosecution by the time of the recorded interview. And certainty that it happened tends to get more and more. The claimant tends to get more and more sure that this abuse happened the more interviews they do.
We've seen, I've certainly seen, Michael and I have seen in some interviews where an investigator or an interviewer is saying, it's not your fault. You're very brave for coming forward. We know this is very hard. I find those, I understand why officers say that, but I find it to be troubling because it can only reinforce what otherwise is false information, making the person much more comfortable to come out with more false information.
That's right. Reinforce is exactly the right word to use. In other words, when you say, well done, you're being very brave, and this happens in some of the cases that I've seen as well.
Yeah.
It incentivizes the person, it rewards the person, and sometimes these individuals are children. It tells them that they're doing a good job, and they're more likely to repeat whatever's rewarded later. And I think, police interviewers should hold back from doing that, even though it's a very natural thing to do, to say you're being very brave. I think they should be trained to hold back and be careful with that.
I think that's really important. We're unfortunately running out of time. I could sit here for another hour or two to discuss this. You've really laid this out very, very well. I know you're off there in England, and we've imposed on you. It's late at night, but hopefully we could have you come back, because there's some other areas I'd like to explore. So if we send you an email, you're going to come back?
Yes, I would love to talk some more. Yes, and I'd love to hear some more questions.
So, Professor, this is fantastic. I want to thank you so much, because I found this very educational. We've been focused in a few episodes on memory, and we're going to continue to be. So we're looking forward to bringing you back in the next 6 months, if that would be okay.
That would be great. Thank you very much for having me.
Thank you so much, and thank you for your great work. This is really very important work that you're doing. So we thank you very much and wish you a very good evening over there.
Thanks again. We'll share this widely with our colleagues as well. Very important stuff.
I understand, especially when you're dealing with a young person in an interview, why police want to try and make the person comfortable. An officer who's empathetic will see that somebody may be struggling, and so they want to try and relate to them and make it easier for them to come out with the information. The problem is the danger that, as we discussed with the professor, that it can incentivize, it can reinforce.
Well, there's a line, right? There's a line.
Unfortunately, I see this in a lot of interviews, especially when you're dealing with a young person. And ever since the Me Too movement, which is #WeBelieve, and you start off from the position of
we believe you,
believing what the complainant is about to say, it's not much of an interview other than reinforcing, you're very brave, thank you, you're doing extremely well, we know this is very hard to talk about abuse regarding a parent. All of that is really tainting the interview, where it could be done in a little bit more of an objective, less emotive manner, still having the person feel comfortable, but we're not having that, and that's something I'm seeing reoccurring. And we spoke in another episode about a hypothetical case we have, and that's something I'm very interested in too, because there's another aspect to this. The other aspect is you can take somebody who, for whatever reasons, has issues in their life, and then they're in therapy, and they come to believe that the person they used to be married to or the person that they used to date was the source of all their problems because they were abusing them.
Right.
And it may not be necessarily a false memory, but they recharacterize how, when they were having intimate relations, when they were dating, that it was actually a coercive relationship. Right. It was one where they were influenced. I mean, that is very... We see this.
It's relabeling, right? It's very dangerous.
It's what we call relabeling. Yeah. It's very dangerous. So what I find so interesting, and his work is great. I mean,
this guy is amazing.
Professor Patihis, I mean, his whole resume is studies on memory and trauma and dealing with all of these areas. But we see this flow into a number of cases that we have that easily can lead to a wrongful conviction. I mean, these are recipes for disaster. We got to have him back on.
Oh, we do. He was good.
Him and Professor Loftus, it's been very helpful because, like you said, it came out in the 80s, it was in the 90s, and then it sort of died off a bit, where we were much more skeptical about these repressed or recovered memories, and now it seems to have resurfaced a bit.
With a new label.
Yeah, although I didn't read it in the DSM-5. It wasn't something I was looking for. But, it's very... It's very enticing when you have something in DSM-5 to call it dissociative amnesia. You sort of label it with something that's a clinical diagnosis, and all of a sudden it becomes real.
Becomes real, validated, yeah.
So, this Professor Patihis is very, very helpful. Yes. This was great. So hopefully you've enjoyed this. We're kind of focused on this a little bit, so we're going to revisit this, I think, in a few months. There's a few other areas we want to go into. But if you have any questions or comments about this, we've been getting a number of comments and emails, again, looking at topics like this, so we really invite it. And I don't know, I can't reach for the pillow now.
I'll hand you mine.
I'm too tired today.
It's okay,
but,
use mine.
But if you like our podcast, please don't forget to like, comment, subscribe, and share. And we can't thank you enough again to all our regular viewers and supporters. Thank you very much for watching our podcast and really having such meaningful input. Have a good night.
Thanks again.
Thank you.